I think getting back to the fundamentals, are the objectives of the incentive plan clear? For some larger organizations, there might be a need to see some regional and divisional or local executions, at that level and cascading goals throughout the organization. That's not going to work for everybody. I think some organizations need to, really look at what they're trying to drive, how they're trying to drive it, where the accountability lies, and then understanding that every market that they serve for larger organizations may not be the same. So that's a tricky thing to do. I think our clients are very vested in success across the organization, but I think really we're looking at, what's the runway for improvement and how do we actually get there? So the fundamentals are super important, right? The clarity of the objectives of the plan, as well as the communication with regards to the expectations and how we're actually going to move from point A to point B. That's where I think the devil's in the details. And you really need to make sure that that is clear for all the plan participants. I think with the known headwinds that are coming for the industry, I think everybody's looking at a way to balance kind of short-term objectives and long-term objectives. So there's still a big need in the industry to continue to grow in profitable service areas and profitable service lines. But that means you're going to have to be, extremely vigilant and rigorous around tightening the belt around every dollar that you're spending on a year-to-year basis. We're looking at job architecture. We're looking at kind of alignment between physicians and APP workforce to drive productivity. We're looking at access measures to make sure that we're meeting the needs of the community. I think all of those things, if done right in the short term, are setting ourselves up for long-term success as an industry, and each health system is dealing with those in their own unique markets. It's not consistent across the nation. Everybody has kind of a different financial outlook and landscape. I think every health system's in a different place. They're looking at their geographic expansion, they're looking at their real estate costs, they're looking at their labor cost, as well as management structure, as well as the compensation plan. So all of those things, if executed on in the short term, are setting the health system up for long-term success. Although every health system has a plethora of areas of opportunity that they can focus on for their incentive plans, I think choosing the 4 to 6, areas that you can't miss and really need focus for the next couple of years is going to be imperative and paramount for success. I think there's also a tie into how the physician incentive plans and APP incentive plans are also tied to the executive plans. Making sure that everybody's rowing in the same direction is going to be critical for the next couple of years as we look at recruiting and retaining providers, as well as executing on the organizational strategies. I think every health system right now is evaluating the impact of the legislation that's passed and the financial implications it will have for their organizations. There's no way to directly pinpoint what the impact's going to be precisely, but the range from high to low, it's going to be somewhere in there. And I think everybody's looking at their financial plans and their long-range strategic plans and understanding where they're going to spend their money and how they're going to save, costs to offset the potential impacts. What that means in this terms of uncertainty is, we've got health system goals that are actually being set a little bit wider than typical with that unknown, with the risk, especially for long-term strategic plans. And understanding where you can actually make improvements to offset some of that. So specific service line growth, looking at revenue, looking at cost control and utilization, looking at, kind of expenses per dollar. If you're in the full risk business, I think a lot of those health systems are looking at how they can shore up their system of care and understand, how to make that most efficient, both for patients and for the health system alike. As plan participants look at balancing achievability with kind of aspirational goals and understanding that these are core components of compensation, this is a very important piece that I think sometimes doesn't get enough time and effort dedicated to it. I think looking at market rates of change, looking at internal rates of change, understanding your probability of achievement so that you can land the ship, right where you want to each and every year with regards to the goal calibration. I think, a formalized compensation philosophy is super important. It can be useful across multiple performance pillars. When you're talking about financial goals, quality goals, infection goals, patient experience goals, obviously those are vastly different areas of performance. But having that formalized compensation philosophy can really aid the entire organization to kind of come at it from the same lens. Where are we currently? Where do we want to get to? And then kind of what does that path look like? And it's not always equal, across all those areas. You may be very well high performing in turnover. You may be less, high performing in financial goals. It's okay to have kind of somewhat different paths to where you want to get to. So some goals may be 2 years, some goals may take you 4 or 5 years. But I think what you're trying to do is build momentum within the organization, understand that these are core elements of compensation, and you really need leadership and staff to buy in for success.